There's a saying in social service agencies that there is no wrong door to access service. No matter where you encounter the system, we'll get you to the right spot for your need. The wonderful thing about programs like Cheers and the Sobering Station is they work for clients who don't even have the wherewithal to access the wrong door. These are people who are brought in unconscious sometimes, incapacitated by their drugs and alcohol. We can develop that relationship and get them to the right services for what they need. It can be trying on the staff if you don't have those outlets. Staff sees the same clients over and over again, and it's a downward spiral until we can get them to more definitive care. So as a harm reduction model, it's wonderful and can work standalone for many, many years, but the idea is start developing these relationships with other programs and find places to send them. Otherwise, it gets very difficult for the staff. Compassion fatigue is what we're dealing with now. They need to be able to see improvement and see that their work has value beyond just maintaining the clients. Since we've been doing this, the Hooper Center will have its 40th anniversary next year. We found that it's very flexible in ways that's kind of surprised us. Our nonprofit social service agency is concerned with housing the homeless, that target population of alcoholics and drug addicts who are living on the street. That's who we're interested in dealing with. But on Friday and Saturday nights, those 23 police agencies bring us doctors, lawyers, students who've become incapacitated by their drug and alcohol use. These people may not be interested in getting into our detox or into Central City Concern housing. It is much more of a public safety issue with this group. We refer to them as the A clients and the B clients. It's become interesting for the staff who's particularly picked and trained to deal with that target population. They're dealing with that other group who have attorneys and can be more litigious and are generally healthier, and the property that the staff has to inventory and care for. With our homeless population, that may be bags of loose tobacco, ID, extra jacket, and that's about it. Very important to those clients because it's all their worldly goods, and we take good care of that. But the type B clients will have laptop computers, yellow metal watches that actually are gold. Brings a whole different burden to the staff to deal with both. And our board of directors has struggled with this. How is this really our mission? But when you talk to the staff, they're not interested in trying to separate out and tease those two different groups. They're very obvious what group they come from at either extreme, but in the middle it gets a little murky, which one is which. And in fact, none of our clients were born homeless street alcoholics and addicts. They came from a population that looks a lot like this type B clients that they're seeing. So that intervention and prevention can actually get started here as well. So here I am in Vancouver, but we've had lots of interest in the Hooper Center from various agencies around the Pacific Northwest, the United States as well. One that had kind of a 10-year process, started visiting the Hooper Center about 10 years ago, is in Boise, Idaho, and they just opened their facility just this year. They have a combined detox, subacute mental health, and sobering center. They took many, many photographs and measurements of our building, asked lots of questions about what you would do differently, and tried to replicate it as best they could. But their laws are different in Boise. They don't have that civil hold where the clients can be detained against their will without some sort of criminal charge. And so the clients are dropped off by the police who say, well, it's either here or jail. Which one do you want? And then the staff is left trying to keep the client there because the law isn't the same. So even though they have that same infrastructure as us, they're having different challenges based on their different laws. And they've also decided that they were uncomfortable staffing with EMTs and paramedics, so they have nurses there 24/7, which boosts their costs up considerably. So they they've only been open a few months. We'll see how that model works out for them in another year or so. We've also been working with Alameda County in California, which has the cities of Oakland and Berkeley in its borders. They were a little bit ahead of Boise, and they faced some of the similar issues with having different laws. But was interesting, and what reminded me of some of the comments here, is when they built the center and sent out requests for proposal to find operators for it, they had a lot of interest in people running the detox part. A lot of people got that. Nobody wanted to do that sobering part because they were uncomfortable with the strictly harm reduction aspect of it. They wanted to try to compel these sobering people to go directly into detox. And they got no takers until the Needle Exchange organization in Berkeley stepped up to run the sobering because they got that harm reduction. So really for me, Central City Concerns Continuum of Care sprung from the sobering station. You get the most bang for the buck. Our detox sees about 3,000 clients a year. Our sobering station does about 12,000 admits a year. Much, much less cost for sobering than detox. Much less cost per client. David asked, does the sobering center save lives? And he mentioned that it's named after David Hooper, the last person to die in jail. And that was in 1971. And the Hooper Center opened that same year that David Hooper died in the jail. And it's kind of hard to show how many lives were saved, but we celebrate our 40th anniversary next year. We're doing approximately 10,000 admits a year, so that's over 400,000 admits that have come through there. Those people are taken care of. They're still alive. Some of them we'll see multiple times. Some of them we might not ever convince to get into for their services, but we did have that chance with them. I think it's extremely successful. And a lot of people ask, if you were starting from scratch, what kind of advice would you give us? And it would be gather baseline data now. Find out what the impact is in the emergency rooms, in the jail, in the merchant storeways. So in 40 years, when one of you is up here talking about the success you've had in Vancouver, you can show those numbers. We didn't have those from the beginning. We have wonderful anecdotal evidence. That only gets you so far. My director, my boss, is a product of the Central City Concern Continuum of Care. She was a street alcoholic in Portland who was picked up by the Cheers van, who was brought into the sobering station, was there many, many, many times, went through the detox program several times before she got into alcohol and drug-free housing, turned her life around, and now she's my boss. So I think that's how I'd like to end that.